Hi, my name is Amanda Mixon and I am a physician assistant at the Arthritis and Rheumatology Clinic of Northern Colorado. Today I'm here to talk to you about rheumatoid arthritis and Vectra, one of the tools that can be used to assess RA inflammation. We all know that rheumatoid arthritis is a systemic disease and can be challenging to manage. At times a patient may think they're doing very well, yet we believe their disease is active, and also vice versa. A patient may believe that their disease is very active, yet we don't actually see synovitis on their joint exam. Adding an objective measure of RA inflammation with Vectra to your assessment gives you a molecular perspective to help inform your medical management decisions. Vectra is a multi-biomarker blood test for measuring rheumatoid arthritis inflammatory disease activity. It is validated for the use in adults diagnosed with RA. Vectra measures the serum concentrations of 12 protein biomarkers reflecting the pathobiology of RA and accounts for age, gender, and adiposity to provide a personalized score on a scale of 1 to 100 that represents the level of RA disease activity in that patient. Vectra is unsurpassed in predicting rapid radiographic progression compared to other disease activity measures. Vectra can help guide personalized medical management decisions to help improve patient outcomes. Rheumatoid arthritis begins at the molecular level. The patient then develops symptoms and the joints show signs of inflammation and damage. Biologics treat at the molecular level. That patient then begins to feel the effects of the medication, and if treatment is sufficient, the joints show lack of a disease progression. Utilizing a molecular assessment along with a clinician assessment and a patient assessment provides the most comprehensive view of a patient's rheumatoid arthritis inflammation. Adequately controlling RA disease may require a multi-assessment approach, but even assessments can be complex. Different measures view RA from different perspectives and may not always agree. This may lead to a discordance between assessments. It's important as practitioners that we not discredit discordance when it arises, but utilize the appropriate tools to clarify any uncertainty around discordance. We know that provider and patient discordance in disease assessment happens 33% of the time, which isn't surprising when you consider that RA inflammation is difficult to objectively assess. So what do you do when the patient's assessment doesn't match yours? So I'm going to give you an example of this. I want to talk to you about a patient of mine named Jackie. Jackie I have been seeing for a few years now, and she has active rheumatoid arthritis. She was diagnosed after she had given birth, and when I initially saw her at that time, she had a lot of difficulty. She couldn't lift her baby. She was having a lot of time even just with the bottles. Breastfeeding was really challenging for her. And then to get this diagnosis of rheumatoid arthritis, it was devastating to her. It did take me some time, but I eventually she agreed to go on medication. So initially I started with methotrexate with her after she was no longer breastfeeding. And then after that, she still wasn't in control, so we added a biologic. She did very well. That biologic changed her life. I mean, she was able to run again. She actually ran in a half marathon. After a couple of years, though, unfortunately, as I was seeing her in follow-up, she wasn't doing as well as she had been. I was seeing more synovitis on exam. It was very challenging to convince Jackie to change therapy. She saw how she was before she had had this disease. She saw how she was when she was diagnosed, not being able to lift her baby. So she was very reluctant to make a change in therapy. I wasn't quite sure what to do, how to convince her. So having a tool like this, I think is crucial for our patients because we can actually give them something objective to tell them, yes, it's time to make a change. And eventually she did, and now she's doing very, very well again. In my experience, using Vectra, it can be very helpful as an arbiter when there is a discordance between my assessment and the patient's. Vectra adds a powerful prognostic information about joint damage and RA inflammation. It provides an objective measure that can be used to complement other disease activity measures to identify the risk of radiographic progression. Radiographic progression is defined as loss of joints and loss of function. Inflammation can lead to structural damage and increased risk of cardiovascular disease and other comorbidities, which can lead to loss of function and disability. As I tell patients, you're not going to die of joint damage, but you will die from heart disease. However, joint damage and loss will severely affect your functionality and quality of life. So I want to add another example here because I think it kind of brings this home. So I had another patient that I diagnosed also interestingly after she had given birth. And when I initially, she also works as a mail carrier. And after I diagnosed her, we talked about different therapies. And she was very similar to Jackie in that she was having a very hard time lifting her arms, but she still could. I talked to her about the importance of starting DMARD therapy to help prevent joint damage and disability. She decided that she did not want to do that. She decided she wanted to take a more natural approach, and so no matter what I said to her, it really didn't hit home. I didn't see her for quite some time, and about 5 years later she came back into the office, and by that point she was not able to lift her arms at all. She had severe joint loss, joint damage. At that point she couldn't even lift her arms straight, and by that point it was too late. Unfortunately, we missed a golden opportunity to get her disease under control, and of course I still treated her, but we can't take back what's already been done. And so I just think it's so important that we really use all of the tools that we have available to us to help our patients understand the importance of starting medication and changing therapy if we need to. Even when symptoms appear under control, joint damage can still occur. Currently, up to 1 in 5 patients in clinically defined remission go on to have radiographic joint damage within 1 year. Vectra is the best predictor of radiographic progression, significantly outperforming DAS28 CRP. When used appropriately, Vectra predicts which patients are likely to radiographically progress, as well as which patients are at a low risk for future joint damage. When clinical measures and Vectra are discordant, Vectra is right in predicting radiographic progression. In a combined analysis of cohorts from OPERA, SWEETFOOT, and Leiden, we found that 42% of patients in low or moderate disease activity, as defined by DAS28 CRP, had a high Vectra score. Of these patients with a high Vectra score and a low DAS28 CRP, 21% went on to have irreversible joint damage. With recent data, Vectra shows to be a predictor of radiographic progression. As seen on this graph, risk of radiographic progression when Vectra scores are low is 1 to 3%, and risk of rapid radiographic progression ranges from 7 to 47% with a high Vectra score. Increased risk of radiographic progression means greater chance of irreversible joint damage. Let's talk about two things. First, how radiographic progression data is represented on the Vectra report, and second, what would I do with this information? If I had a patient who was at a 20% risk or higher with a high Vectra score, I would look at how to course correct and consider a change in treatment. I know that this patient is at a significant risk of joint damage within a year. So let's bring it back to the patient I discussed earlier. If I had had this information to show the patient, perhaps I would have convinced her earlier to begin therapy. By the time I saw her 5 years later, she was unable to raise her arms above her head. She was no longer able to work as a mail carrier, and she could not lift her children. Let's talk about how we put this information to use. If I had a patient with a low score, then I know their treatment's working. If I saw a patient with a high Vectra score, then I know something is happening that needs to change. Whether they are not being compliant with their therapy or need to change or increase therapy. Let me talk about how I use the Vectra report as a communication tool with my patients. First, let's look at what's going on the report and how to utilize it. The Vectra molecular result dashboard contains several different sections, the first being the Vectra score. This is the numerical value on the 1 to 100 scale that is the patient's personalized score. The score is color-coded to correlate with the high, moderate, or low range of RA disease activity and inflammation. The Vectra report was recently updated to include the risk of radiographic progression, enhancement for risk of radiographic progression, with a chart indicating the patient's risk over the next year. Next is the change in score, which shows the difference between multiple scores and will indicate if there has been a meaningful change or if there has been no change in disease activity and inflammation. As a reminder, a meaningful change is an increase or decrease in 8 or more units since the last Vectra test. Next is the Vectra score interpretation. This section provides a more detailed explanation of the score, disease activity category, risk of radiographic progression, and considerations for the patient's treatment plan. Also included on the report is the radiographic progression grid, which shows the patient's risk of progressing radiographically within the next year. Let me give you an example of how I'd use this to talk to a patient. We know that nurse practitioners and PAs are really good at talking to our patients. We are able to put things in terms that patients understand. When I talk to a patient with a high score, I simply explain that you have a higher risk of joint damage that will affect your quality of life. But more than that, having eye inflammation affects you systemically. Lastly, let's talk about how Vectra should be used in the office and how it can help inform your treatment plan. Ensuring success of controlling rheumatoid arthritis inflammation by using Vectra at initiation, when changing drug therapy, and to monitor response to treatment. Let's take a closer look at the treatment pathway. Testing with Vectra is recommended at the initial patient visit or any time during a management decision to make a treatment change. Then, Vectra can be used to monitor and evaluate if the treatment is working by testing every 3 to 6 months. Once a patient is in low disease activity, as indicated by a Vectra score in the low category, continue to test once or twice a year to ensure that the patient remains within treatment goal. This pathway can provide patients with better outcomes through improved communication, timely evaluation of treatment response, stratification of patients for risk of radiographic progression, and assistance with medical management decisions. Managing the complexities of rheumatoid arthritis can be challenging, but with Vectra Enhanced Care, you can utilize a molecular assessment along with your assessment and the patient's assessment to get a complete picture of rheumatoid arthritis inflammation and help provide your patients with better outcomes. Thank you very much for joining me today.